This procedure video will take you through the techniques for inserting a central line into the internal jugular vein. It is unlikely in the exam that you will be asked to perform the entire procedure, however it is more than possible that you may be asked to perform a part of the procedure or even to talk a medical student through explaining the procedure itself. Take some time now to familiarise yourself with all the equipment seen above, as you will certainly be expected to know how to utilise all of this in the MChem OSCE exam. Remember also that, as with all procedures, you will be expected to use universal precautions such as hand washing, using gowns, gloves and eye goggles.
So I'm going to start by cleaning the skin with some chlorhexidine solution or suitable antiseptic. I'm going to clean a nice large area. And then I'm going to make sure that the area is fully draped. With sterile drapes. I'm going to apply some local anaesthetic, and I'm going to approximate the position of the internal jugular vein by feeling for the cricoid cartilage. Laterally, I can feel the carotid pulsation, and just lateral to this is where the internal jugular vein should lie. I'm going to infiltrate in the skin around this area with 1% lignocaine, aspirating before I inject to ensure I'm not in a vessel. And I'm going to infiltrate into a reasonable area. I'm going to allow that a few minutes to work, and in the meantime I'm going to check my equipment. Once the local anaesthetic is taking effect, I'm going to check my equipment and flush my lines. So with sterile saline, I'm going to make sure that all 3 lumens on this line are flushed and patent. You can apply the bungs to the end of all but the distal line. So under direct ultrasound guidance, I'm going to insert the needle into the internal jugular vein. As I go through the skin, I'm going to start aspirating on the syringe. You get the flashback and know you're in the vein. You might want to advance a millimetre further, remove the needle, and feed the guide wire through the needle into the internal jugular vein. It should pass without resistance. At this point you would want your assistant to keep an eye on the ECG monitoring to watch out for ventricular ectopics. Remove the needle and leave the guide wire in place. In order to pass the multiple lumen lines, you will need to dilate the skin. So first, make a small incision at the site of the guide wire. And then pass the dilator over the guide wire. And then through the skin. Twisting slightly, it should slide easily through the skin and into the vein. Withdraw the dilator, leaving the guide wire in situ, This line over the guide wire, making sure you keep hold of the guide wire at all times. Holding on to the guide wire still, the central venous line should pass easily through the skin and into the internal jugular vein. You want to advance the central venous line up to a point marked on the edge, in an average person somewhere around 15 centimetres. You then want to withdraw the guide wire from the central line. You must check that all the lines are patent and that all the lines aspirate blood. Aspirating blood and then flush with normal saline. Repeat this for the other lumens. Once the line is in position, it needs to be secured with sutures and a dressing. The pack comes with an adjustable connector that can be put over the line near the skin and then sutured in place, and allows the line to be repositioned once the chest X-ray has been performed.
As in all procedures, it is important that having finished the procedure, you go back and reassess the patient's airway, breathing and circulation. Having confirmed that the patient is well, you must now document your procedure in the notes. Be sure to document the size of the central line inserted, the number of lumen on the central line inserted, to also document the site of the central line's insertion, and also any complications that may have arisen during the procedure. Order a chest X-ray to check the position of the central line and explain to the nursing staff that the line may not be used until the chest X-ray has confirmed its position.